Hey everybody, as this COVID virus continues to go on, I keep hearing reports of, oh, this is no different than the cold, this is no different than the flu virus. And I want to tell you that this is definitely different than the influenza virus. And I didn't really fully understand, like you, probably what the true differences between COVID and the influenza virus were. So I kind of went back to medical school. I went back to researching and looking at virology and looking at more things about the virus itself and how I can ultimately explain to you the difference between COVID-19 and influenza. So real quick, we are going to go through several questions in this presentation. What is a virus? How does it transmit to humans? How does it mutate? How does it spread to others? How do we get immune, and what is the cause of death, as well as how is it treated? So we're going to go through all of those questions. So as you can imagine, this is going to be a lengthy video, as almost all of my videos are. My name is My name is Dr. Philip Oob. I'm a practicing functional medicine doctor in Austin, Texas, and I am putting out more and more information on COVID-19 as far as testing and helpful links and things to understand it. So please go to my website, oobmedical.com/COVID-19. There's updates, videos, all kinds of stuff that I continually update throughout the day as time goes on, and I will try to keep it newest on top so you can see what is coming out. If you go on that website, you can also subscribe to my COVID-19 newsletter, and I promise not to spam you. We're sending out regular updates. I'm doing live Q&As, and we're sending out ways to be healthy, immune tips, all those things. So subscribe if you want to stay in tune. The other thing you can do is you can text COVID-19. You can't read this too well on the screen, but text COVID-19 to 415-528-7403, and that'll get you also subscribed to the same list. So let's dive into a little bit more detail about, first, what is a virus? So what is a virus? Here is the influenza virus. It's pretty gnarly looking, but a virus is not a living organism. So it is a very, very simple thing. I guess not an organism, it's a thing. And so all it is composed of is, composed of a DNA or RNA. This is the influenza virus, so this is RNA inside. And this RNA is the coding material this is everything it needs to make more viruses. These little blue and red things are what's on the outside, and these are the landing spots. So these little things are kind of the hand that once you inhale this influenza virus or it touches your nose or whatnot, it latches onto your cells, and this is how it gets inside. It hijacks our own body's cellular structure to get inside. Once it's inside, it uses its RNA to make more viral particles and spread further. And we'll go into a little bit more detail there. So here's the descriptions off to the side that you don't really need to know. So that is the basis behind what is a virus. So here we have, this is the same viral pattern for both COVID-19 and influenza. I had to go back a little bit to realize that this is a positive RNA virus and influenza is a negative RNA virus, but that doesn't actually matter. It's just for us nerds that it matters. So let's talk about how this virus gets to infect the cells and spread all around. So the first step is the virus tricks the cell into being engulfed. So you can see here that the virus lands on your cell, and there's those little landing sites, and it tricks it to get inside. And as you can see, once it starts getting inside, the cell actually accepts it and says, hey, whatever this is, it wants to come inside. It knows our secret passcode to get in, and so there it is. It's inside. Let's follow the PowerPoint. Let's see if I have more arrows to go. So now it's inside the cell in there, and then it uses its own viral tools. This is incredible. It uses its own viral tools to make more RNA. So it comes with its own set of tools to make itself. And then after it makes its own more RNA, then it uses its viral RNA to make more tools. This is incredible. So it comes in with tools, makes more tools, and then it starts assembling a virus. These tools make more viral particles, and you can see these viral particles are now a fully assembled virus. Once it has fully assembled viruses, that virus says, I want to get out. And it makes its way to the surface, and it knows the secret passcode to get out. And there it is getting outside of the cell without even killing the cell. Some viruses actually kill the cell on the way out. This one just kind of makes its way out and continues making more viruses inside of the cell, probably until it dies from burning up and trying to create too many viruses uncontrolled. And then, of course, this viral particle goes to infect other cells and starts the whole cycle, and that's why you feel like crap. So what does this coronavirus look like, since we know what the influenza virus looks like? Same basic structure. No, it does not look like Satan, and no, it does not look like toilet paper, although you should stop buying and stocking up on this to save some for others. It looks like this. And so the basic structure is very similar to the influenza virus. It has these crown-like, that's what corona stands for, it has this crown-like appearance on the outside. Here's the RNA and showing that's kind of stuck to the plasmid exterior, and it uses these hooks to get inside your cell. Once it's inside your cell, it makes RNA and blah, blah, blah. So you understand it now. So how does this all come to bear? And this is the same process for both influenza and COVID-19 and coronavirus. This diagram is actually an influenza diagram. And so what I put together is just a few ways for these things to spread. And this is a normal part of humanity, a normal part of life that is supposed to happen. And in a bit, we'll get to the not so normal part and how COVID-19 got developed. So this is a normal diagram, and I've got the things listed. So the pig can transfer it to pig. There's no two pigs on here, but the pig can transfer it to pig. The pig can transfer it to bird, and the pig can transfer it to human. Whenever it goes from animal to human, we call this process zoonosis, just like you go to the zoo. So a zoonotic infection is anytime a viral virus transmits from an animal to a human. So now you have zoonosis. So pigs can do it. Birds can do it. You can transmit bird-to-bird influenza, hence the bird flu. There was a swine flu, there's a bird flu, it keeps going. Birds can transmit it to pigs. Birds can transmit it to humans. Each time, and once again, that process is called zoonosis. And then each time it transmits to a human, it mixes with the human genome. Each time it mixes with the pig, it mixes with the pig genome. And sometimes the genetic sequences get confused, and all it takes is one little jump to a human with the right little cellular confusion or DNA confusion, and now all of a sudden it has created the ability to go human to human. Once it can go human to human, now you have a different flu strain, okay? Well, that's the basic premise. It gets more complicated. So how did MERS develop, the Middle East Respiratory Syndrome? How did that develop? Camels, actually, as people have pointed out, they spit, right? So that's one of the ways it's transmitted, but just people around camels, breathing their air, hugging, loving on them, touching it. It's a respiratory virus, so they get it, and now you have MERS coronavirus. That one was fairly short-lived and not too dangerous. And so how did each virus develop? We just went over MERS. You can see it down here. I think this slide is actually going to point it out. So the first one was SARS. That was the big one that happened many years ago now. And you can see it started as a virus. It was in the bats, and then it went to that animal. I'm not sure what that animal is. And then it went to the SARS-CoV, SARS coronavirus, right? And we all know what happened to that one. Then there was the MERS coronavirus. And now we have this SARS coronavirus 2. Also known as COVID-19. So SARS-CoV-2, is actually the virus name. COVID, as you saw in my previous video, if you watched all 40 minutes of it, the disease that SARS-CoV-2 causes is called coronavirus disease 19, COVID-19. So the actual virus is called SARS-CoV-2, if you care to know. But the idea is same thing, from bats to that weird animal to whatever it is. Or I don't know that we fully know where it came from yet, or at least I don't know. It doesn't really matter too much. But what I want to point out next is, so now you understand that these viruses can transmit from different animals to different animals, then to humans. But how does that happen? How does a mutation go from a virus infecting animals only jump to a human? And there's two different ways for viruses to mutate. Actually, this is kind of the same way, but they're minor and major shifts or mutations. So there's what's called antigenic drift. And the way to think about this is as the virus is going through and infecting people, it's just kind of drifting along. The mutations are mild and small, and so from one person to the next, it may change a little bit, but ultimately throughout the year, the flu virus stays about the same. But this is also why there's a different flu virus every year, is that by the time the end of the year has gone around, and it's gone around the globe, it has made enough drift that it's going to come back as a different virus, and you may not be immune to that. Naturally, some people will be immune, but some people will not. Most people will not be. So that's why they update the flu vaccine every year. And this is also why the flu vaccine is a guess. They have to study and figure out which flu virus is going to be the predominant one next year, and they make a guess and they create a vaccine around that, but they're not always right, and that's why the flu vaccine gets missed and it gets a bad rap because of it. But ultimately, it does help cut down on flu, right? So this is called the antigenic drift. And you can see you've got circles, and the circles have gone to semicircles, and so pretty much the same looking thing, but a little bit different. That's drifting. But then you have over here antigenic shift. So the idea there is you have taken a major mutation and shifted it very quickly, and that shift creates a whole new virus, right? So you've got a mixture of Louisiana particles over here. You got your purple, your gold, and Mardi Gras colors. So you've got your 3 different viruses, totally different. Say one's in a bat, one's in what were animals, one's a camel, one's a bird, pig, whatnot. And when these 3 viruses start infecting different animals, they start mixing DNA and mixing, or RNA in this case. And once they mix these things, that's when you really get a Mardi Gras parade. And you've got all 3 viral particles that now makes it a unique virus that's different, and your immune system is not ready for it because it's completely different. And that's why you see small mutations here, yet way down here in the corner, it says, this is a whole new strain of virus. This is a different beast, okay? Oh, I was trying to point that out with the slides and I beat it. So this is once again, the annual flu change, and this is the antigenic shift, which says it is a new strain of combining those 3 different pieces. That creates a pandemic when you have a brand new virus that is totally unique to the immune system of the human population. So how do these zoonotic shifts occur? You can see here with this diagram that you've got humans and pigs in the middle. They're the common ones that kind of accept numerous ones. You've got dogs, you've got camels, you've got bats, you've got cats, chickens, birds, horse, sea lions, and then these other influenza Ds. But anyway, all this mixing pot is basically what creates this mixing of viruses between each other. And so we're commonly focused on the ones that affect the humans, but these influenza viruses can jump all around to the different animals. In fact, one of our old flu drugs that worked was called amantadine. Now we use it for neurological conditions, believe it or not. But amantadine was used for the flu virus, and in fact, it was so good, the Chinese started using it in their farming practices. They used so much amantadine to try to prevent the flu from jumping between animals that actually all flu viruses now are completely immune to amantadine because it's been overused. Interesting little fact. So that's why we can't overuse flu medications, because the flu virus will get immune to it, and then we got to develop a new drug. So mixing humans and humans, mixing human and animals, mixing animal and animal genomes, or RNA, is how you get these shifts. So I did a little bit of research, and my friend Chad sent me this video that heavily explains how this COVID-19 virus developed, and it's an incredible video. I'll post the link, and actually I think it's already posted on my website, ubmedical.com/COVID-19. If it's not, I will put it there. And this explainer video is wonderful. If you really want to know all the details behind how this happened, this thing explains the political decisions behind why China made these decisions, why this is happening. And it's not necessarily good. It doesn't put China in a good light, but when you understand why they made the decisions, it helps a little bbit. So these wet markets in China, specifically this virus came from Wuhan, China. And so the idea of this animals mixing, we've been talking about this shift all the past few minutes, and the idea is this antigenic shift happens between animals. Well, if you notice, I selected several different pictures, and if you notice, these animals normally are never this close in the wild. In this picture over here, you can't see it too well, but there's a snake, there's like tiny little bears of some sort up here, and then there's some sort of goat down here. These are 3 animals that never would exist in the wild for long periods of time, right? The snake would probably eat one of them, and it wouldn't really exist long periods of time. So these viruses can get milked in this population and spread between animals very easily and rapidly, and each time it spreads, it gets to mutate, right? Here there's cages of animals. There's 2 or 3 different types of animals all mixing together. The cages are also stacked on top of each other, so if one animal's infected and bleeding or pus or pooping, the other animals get it on their skin. So talk about exposure. Here in America, we're socially isolating ourselves to get away from this virus, not even touching, shaking hands or anything. And here these animals are crapping on themselves, spreading viral particles all over the place. So this is how these things get spread. So let's look at my notes. Yeah, cages stacked and pus and blood. Each animal carries its own viruses. There is a bird flu, there is a swine flu, and so mixing of these is what happens. Now, these are coronaviruses, not the flu viruses. And then, of course, yeah, you mix animal and genetics long enough, and you will get major viral shifts. That's what happened with this coronavirus. So now that we know that the coronavirus, COVID-19, has manufactured a shift to get to humans, right? It was circulating in animals, and then it made a shift. Or here, let's do this diagram. So here we have it. I'm just using the SARS coronavirus diagram because that's the only images I could find. But let's say it starts in the bat, and this animal I should have figured out the name of before I started this presentation. And it transmitted from animals to animals for unknown periods of time. Stayed there. Next step. Animals to humans was a unknown period of time. Meaning, wait, let's go back a second. So everyone commonly thinks, including myself, when I say animals to humans, that all of a sudden, oh my gosh, humans are transmitting to humans. No, this is a specific virus that only goes from animals to humans. Animals to humans, animals to humans. Cannot go from human to human. So the Chinese government, from what I understand at this time, it is March 20th, from what I understand at this time, this animal to human transmission was discovered in November, December sometime, but the human to human developed rapidly. And apparently this transition does not usually happen this rapidly, because the article I read said that within 2 weeks a mutation was a big deal to go from animals to humans to human to human. So within 2 weeks this virus went from human to human, and now within only a couple of months is now across the entire globe. This is scary, and it is spreading rapidly, right? So this is a mutation to get to animals to humans. This is a mutation to get to humans. We don't know how long this one really took, or I don't, but it sounds rapid. And then the next step is it mutated again when it created a second strain. So at this time, we know that there are 2 strains. What we don't currently know is which strain is in America, which strain is in Italy, all that stuff. And we really don't know which strain is worse, or at least I don't. And at least I haven't seen the research proving that one is definitely worse than the other. There's an L and an S strain, they're saying, and that's about as far as I know. But regardless of where these strains are, how severe they are, there's 2 different strains. In a matter of 2 weeks, it went from human to human, and then in a matter of less than 6 months, this thing's only been around since November, December, it's already got 2 strains. This thing is mutating quickly, and that's what makes it a little fearful. And also, there's been recent reports saying that it's going from human to dog. Now, this is still very early, and I've caught some flack online. This is not saying that dogs are the carriers. The humans are the carriers. The humans are putting some animals at risk. So please don't abandon your animals. This is not saying anything is wrong with the animals. Something is wrong with the humans. Now, this has only happened in 2 dogs in China, and so that's probably a unique mutation in China, in Hong Kong, and that is unlikely to get propagated because, once again, this is a spontaneous mutation, and as long as the dogs are isolated, and usually in big cities like in Hong Kong, there's not a lot of wild animals running around. In third world countries and things, there's more wild animals running around, so more likely to be a pandemic. In the U.S., most of our animals are indoors in our own homes, so they're already socially isolated, and they're not hoarding toilet paper, so they're probably going to be fine. But I just point that out because possibly there are 3 antigenic shifts in a matter of less than 6 months. So that's one of the fears of why some people are saying that we might be dealing with this for a year, maybe even longer, because if it keeps mutating, there's no guarantee that if you get the virus once that you'll be immune to the shift next time. Drifts, you can stay immune to it because it doesn't change that much and you can stay immune to it. But if it keeps making these major shifts, we may not be immune to it. It sounds like some good therapy is down the pipe, so hopefully this will not be a major issue long term. I'm certainly not saying this to scare people, but it should at least put into your mind as far as why is this virus different than the influenza. This is not happening in the flu virus. This is only happening in COVID-19, and it's the worst one to date. So how is this virus spread? What's the transmission? And guys, this is the key to COVID-19 and why it's so bad. The key to a virus spreading, if a virus really wants to spread, it needs to do a couple things. One, it needs to keep its host contagious as long as possible, and it needs to keep the host silent as long as possible so it doesn't know it's spreading. One of the reasons why Ebola is so self-limiting is because Ebola kills you, and it kills you fairly quickly. You're sick quickly, and you die quickly. So Ebola is not a smart virus because it doesn't leave its host around on the planet very long to spread. COVID-19 is the worst one thus far that leaves its patients, leaves its infected hosts infected and spreading viral particles before they're even symptomatic. In many of the cases, don't even have symptoms. So people are walking around spreading it and they don't even know. That's why this social isolation and quarantining is critical, because there's no telling if you're healthy and spreading the virus all around, and this thing is sticky. It likes to infect people. So let's go through some basic difference between COVID-19 and influenza. This part was fascinating. COVID-19 is stable in the air for 3 hours. So what? So is the flu. But what I'm learning is, and all this is still preliminary and early, what I'm learning is that the influenza virus we talk about is in respiratory droplets. This is a great picture. I encourage you to download the slides and look at it. I mean, this guy, this powerful sneeze, he looks miserable. There's particles that you can't even see coming out of his nose that's meeting with the mouth stream. And I mean, it is just blowing chunks. It's disgusting. So the problem with the thing that happens with influenza is that it's spread through respiratory droplets. Well, these respiratory droplets are heavy, and so they fall to the ground. So yes, the flu virus is stable in the air for 3 hours, but it's in the respiratory droplets, which are mostly on the ground. So if you're not licking the ground, you have a lower chance of getting it. If you're not in healthcare where people are coughing and sneezing on you and around you all the time, then there's less respiratory droplets in the air. This COVID-19 virus from early research is showing that it is stable in the air and it is light as air, so it is hanging in the air for prolonged periods of time, which is unusual. Perfect for an asymptomatic host. Asymptomatic means you don't have any symptoms. An asymptomatic host would be breathing around people in a small massage parlor or hair studio or whatever it may be. They're spreading the particles and don't even know it. On surfaces, I've heard there's stability testing for the virus to be stable up to 9 days. That's crazy. The flu virus is only stable on surfaces up to 24 to 48 hours, and this thing's stable for 9 days. Hence the whole like wiping down countertops so aggressively, because this thing just hangs around. Now, I don't know if that one's been confirmed, but we should at least suffice it to say that it's longer than the flu virus and it's working. So the other thing I pointed out when I first got to this slide is that the most important part is to keep the host asymptomatic without symptoms. So here I have symptom onset is very slow and mild before you get the disease. And some people feel like they get hit by a Mack truck, but by the time they've been hit by the Mack truck, they've already been creeping up on the disease. But most people have slow, mild symptoms, and I feel fine, so I'm going to work, I'm going to the grocery store, I'm going to everything, and little do they know they're spreading viral particles. So when that happens, there's no self-isolation. What do I mean by self-isolation? I mean the influenza virus. You get sick pretty quickly. I think it's a 2 to 3 day, yeah, I've got the incubation period down here. So these people that are slow and mild, the incubation period is 5 days. From exposure, incubation means from the day you're exposed to the day you show symptoms, that's 5 days. But this virus seems to be shedding particles even before this you're showing symptoms. Whereas the flu virus is quick, it's 2 days. So you have less people to infect, because within 2 days you get hit by that Mack truck and you feel crappy, you feel sick, you're too tired to even get out of bed. You're not choosing to be self-isolated. It chose you to be self-isolated, laying in bed, not spreading the virus around. So that's another reason why the flu virus is less likely to be spread so quickly. The next one is this virus seems to have excessive viral shedding before the symptoms appear, which is different than the influenza, which mainly sheds viral particles while symptomatic, coughing and sneezing and all that stuff. So that seems to be the differences. Once again, this is all early information, and it very well may change in the near future, but even if it is changing or getting more solidified, it's not going to be that much different. The big difference between influenza and COVID-19, at least what I'm reading and understanding, is that influenza we've known about for a long time. Boy, asthmatics and people with COPD have a rough time with influenza. It causes the bronchoconstriction, which is the wheezing, the squeezing of your lung tissue. It's very inflammatory. It prevents you from being able to breathe very deeply. But for asthmatics and COPD, we've got steroids, we've got inhalers, we've got ventilators, of course. We've got different ways to treat the influenza. But it seems like the primary way people are dying of the influenza virus is actually developing a secondary pneumonia. So we call it secondary, meaning the primary infection was the influenza. The influenza created a bunch of mucus in your lungs. Once your mucus is there, bacteria starts propagating in that fluid, and then you have a pneumonia because you're not clearing that fluid very well and you're inflamed, your immune system's down. Both of these viruses like to disrupt your immune system and lower your leukocytes, your lymphocytes. I posted that in my last video as far as your white blood cell count goes down instead of up, which is interesting. So this pneumonia, but as you know, we can treat pneumonias with antibiotics. So you treat the pneumonia with antibiotics, and then the person recovers from both the pneumonia and the influenza, and God forbid they get sick enough that they need ventilators. There's not a hospital overrun situation, so there are ventilators available. COVID-19 seems to be a lung eater, as someone coined the term. And so it likes to cause aggressive respiratory distress. So we call this ARDS, acute respiratory distress syndrome. It really should be aggressive respiratory distress syndrome, because this stuff is bad. As you can see in this chest x-ray, there's no like fluid filling up the lungs like I had back in January. This guy or gal, guy, there's no boobs, This guy has what they call ground glass opacity throughout the lungs, and that just means there's tons of fluid and tons of inflammation all throughout the lungs. Guys, your lungs rely on a microscopic thin lining in order to absorb oxygen. You don't just breathe oxygen and it magically appears into your bloodstream. You breathe oxygen into your lungs, and then it's your lungs' jobs to have the tiniest little microscopic grapes of alveoli. These it's like tiny little sacs that are microscopic, and we call them grapes because they're a bunch of sacs tied to this airway, and you get this air into these tiny little sacs. Once it's in that sac, you have to have a thin line of tissue so that this oxygen molecule can diffuse straight across that tissue into the bloodstream, and then the blood binds to iron and your hemoglobin, and then that blood goes on to carry the oxygen all around your body. This is a microscopic thin layer. Any inflammation, any water, any fluid starts increasing the distance between the oxygen and the blood vessel, and that tiny distance that expands creates a huge diffusion problem, and then you can't oxygenate your cells, your hemoglobin. And so the only solution for these people, because basically when you can't oxygenate, you need oxygen to breathe, and you're working harder already, so you need more oxygen to facilitate breathing, yet you don't even have the oxygen, so you tire out and you die. The solution here is ventilators. You breathe for the person because it's so exhausting to breathe when you don't have enough oxygen and you're trying to pull air through this fluid-filled, inflamed, restricted lung. Not only that, you've got this huge diffusion gradient of getting the oxygen across the thin tissue, so they have to pump you full of high levels of oxygen in order to force that oxygen across that diffusion gradient in order to get you any kind of oxygen. This is a difficult process. This is not a quick process. This takes days, sometimes weeks. This is where we're concerned about happening, because although this person looks a little older based on their skeletal structure, it's not my patient, just from Google, they're a little older based on the clavicles and stuff. The likelihood of this happening to younger folks is also happening. Now, it may not be this severe, but nonetheless, if you tire out and you need a ventilator and there's not one available, you don't have good chances. Okay, so people are dying from this respiratory distress syndrome, not so much from the pneumonia. This virus seems to shed so many viral particles inside of you that it's aggressive and quickly infects your lungs. And anyway, I think I beat that horse to death. So let's move on to treatment options, which are not many, and I kind of talked about already. So with COVID-19, there's a ventilator, there's CPAP, there's BiPAP. There's some early medications that are proving effective, and gosh, I hope they're real, but I'm really worried that they're going to go in shortage and not be able to treat enough people. I won't address the medications thing because I think that's still early, and I don't want it to contribute to the shortage. But I will remind everyone that you have an ethical duty towards the general public, that if you are healthy and not sick, please do not stock up on medications that could help someone else when they are sick. Same thing with antibiotics, same thing with asthma medications, whatever it may be. Get one for yourself if you need one to have on hand, but please don't stock up on 3, 4, 6 that you don't necessarily need. Or if you are stocked up and you know someone that's ill, please donate it, give it to someone else. I know we're told to never share medications and never give medications back to the pharmacy and all that, and you're still probably not allowed to do that, but this is a time to help people. Someone else's medication is better than dying, right? Whereas on the influenza side, we have multiple treatment options, even if they're not that great. I actually did a video on how these medications aren't even that great a while back. So there's Tamiflu or oseltamivir, which isn't that great, but maybe it helps cut down the burden a little bit so that you can fight it off. There's Influenza, which is the new one that came out, I think, this year or last year. It's super expensive. It's a one-time dose. Seems to work okay. And then, of course, for the pneumonia, there's antibiotics. So the complication of the influenza is the pneumonia. Well, if you can treat the pneumonia, then you're likely to live. So that's another reason why the influenza is less scary. The biggest reason, though, why influenza is totally different than COVID-19 is because of this herd immunity. Now, the vaccine thing in functional medicine, of course, is a hot topic. A lot of people don't believe in vaccines or believe they're dangerous. The truth, in my short stint on it, is that vaccines are not totally harmless. Vaccines are not totally harmful. There's a middle ground there. They're not for everyone, and they're definitely not for no one. So the whole idea is that if you can get enough of the population immune, then it can't propagate around. So these 6 diagrams, the blue people are the non-vaccinated, so everyone can get the disease. And then as you start thinning out the number of people that can get the disease, it's harder to spread it. There's a great graphic that I found, and it's posted on my COVID-19 website, where these little dots are actually active. So as soon as you scroll to it, you can see what no quarantining does. It's written for the quarantine. So you can see what no quarantining does and how quickly they get infected and how quickly they recover, but that would overrun the hospital system. And then as you increase the quarantine, you can actually see how much longer it takes for that peak, that whole flattening the curve idea. It's a really neat model to look at. It's based on computer algorithms. So once you develop enough herd immunity, and I've heard the magic number from other researchers is 70%. Once the 70% of the population can get immune, it's really hard for the virus to propagate. So right now, every one person infects 2 to 4 people. Well, if you use those same numbers and say, well, 2 to 4 people, 70% of them are immune, one person can only infect one person. And that slows down the spread tremendously based on that data right there. So there's still no vaccines for COVID-19. There's no passive immunity whatsoever. As far as I know, no one is immune to this unless you just are lucky, or maybe got a previous coronavirus that you didn't even know you had. But anyway, this is the idea, is that we've got to spread the immunity, but we've got to spread the immunity slowly over time in order to not overrun our healthcare systems. So the COVID-19 testing, I've been reporting that there's kit shortages and all that. The shortage is slowly ending, although today I heard Baylor Scott and White ran out of test kits. I'm sure they'll get more soon. But we currently have test kits available. If you go to ubmedical.com/COVID-19 testing, that's hyphens in between, COVID-19 testing. I will keep that website up to date as far as who can we test. If we don't have any test kits, I will put on there, we are out. But currently we have test kits. We are willing to test the public. So we have test kits for our patients that we can use insurance that we're reserving for our patients. But right now we've got test kits that you can do cash pay for. It just goes to a different lab, and this different lab does a respiratory panel instead of just COVID-19 by itself, and that's why it may not be fully covered by insurance. As soon as we get enough test kits for insurance, we will also be testing the public with insurance. So the pricing is all on the website. I don't want to say anything now because it may change in the future. If you go to the website, it's very clear cut. If you're a patient, if you're not a patient, if you're insured, if you're not insured, and I will keep that up to date when we get the insured test kits in. So be sure to check that. I'm getting cut off over there, but if you sign up for our website, text the COVID-19 to that phone number, or sign up on ubmedical.com/COVID-19, you will get my top 10 immune boosting tips. There was actually a error, number 2 and 3 are swapped, so I apologize about that. But it's 10 ways that you can improve your immune system, and I've got a big hint. A big portion of it is nutrition. Look at how beautiful that is. I wish I could make food that beautiful. It is never that beautiful, especially my eggs. It's always, and plus this is like a cast iron pot looking thing. I don't know how they did that. Clearly staged. I will be doing Q&A sessions. They seem to be working very well. People have really good questions. So my next Q&A session is actually tomorrow, Saturday at 2 p.m. If you, once again, subscribe to the website, we'll be sending out links to when it's available. You'll get the link through the subscription. I'm trying not to spam anyone, but we want to keep people informed. So that's all I have on this influenza versus COVID-19. You're welcome to leave comments and feedback. I am swamped right now, so I'm trying to respond to as much as I can, but please don't take it personal if I'm not able to respond. Also, leave your questions. There's an email address once you subscribe that if you have a question that you want us to answer in the Q&A or in my videos, send it to that email address, and I will do my best to address it. So until then, stay socially isolated, and let's keep fighting this beast, guys.